members to join. Okay, let me ask Brittany to join. Good morning, Brittany. Hey, can you please join the meeting? I wanna test the little speaker. Yeah, please. Thank you.
Hey, Maria.
Hey, Brittany.
How's the
Can you
audio?
hear?
I can hear you. I noticed there's a little bit of a lag.
Is it?
Yeah, okay. Now you sounded really far away.
And I'm noticing that this thing is not working.
Like now that you're close to it, I can hear you, but when you were like, I guess a few feet away, you could barely hear anything.
Can you hear me now?
Yeah, I can hear you now.
Okay, so that's the speaker. I'm right next to the speaker. That's what's going on.
Okay, because right now how you were standing like what 2 feet forward, it got really quiet, like I couldn't hear you.
Oh, really?
So I don't know what's going on.
Let me see if I can. What's the volume? The volume. Okay. Can you talk now?
Okay, I can hear you like pretty good now.
Oh, okay. So
But you can't hear her that good, huh?
I can't hear that good though.
So
No.
doesn't she supposed to come through the speaker?
No. Why is that?
Why is the speaker attached?
It's right there.
I know, but she's supposed to be coming through there, right?
It's supposed to coming through. I don't even know where.
Yeah, the speaker. That's why it's attached.
But can you hear me well?
I can hear you clearly.
She's coming through here, right? Speak, Brittany.
Do you hear me, Grace?
Oh, yeah, barely.
I know.
We can change the volume on there.
It's already all the way up.
Is it?
Yeah. Yeah, it's already 100%.
How does Dr. Bradley do it?
Can you ask Dr. Slide? See how they use it? Can you hear me?
Yeah, I can hear you.
This thing is not working. Well, it's working as a speaker. No, as a thing, as a microphone, but it's not really a. I'm gonna bring another thing, okay? Hold on.
Alrighty.
Did you see that position? Clinic is in this. she's at that meeting for Dr. Brett.
Yeah. Okay, I'll call you right back, okay, Brittany?
Is there a tab number on there?
No.
Hey, we're trying to get the volume set up on the Teams meeting for the training room, and it's not going up. It's like it's all the way up, but you can barely hear it. Does it have external speakers? Like, yeah, we have a speaker hooked up to it. Yep. Yes. Okay, hold on. Yeah, that's not working. Is it? I'm sorry. To the both. Uh-huh.
We have 14 attachments over there. Okay. We have 14 attachments. So,
Okay, I have to go. We'll call you back.
they're supposed to grab one by one.
Okay.
They didn't give us any other instruction. I think that's too much. What we could do is like create a packet.
Okay.
For the whole thing. But
Okay.
I don't know which order it goes to.
I don't have any other information than what was sent by
Like,
the AA, so I don't have any.
Well, we'll just wait till they get here then, because, yeah, we don't.
Oh, okay.
I'll
The other thing is that it's too low. The voice is too low.
Yeah, I was worried about that.
Mm-hmm. It's very low.
Even with the extra speaker setup.
So is it attached to the computer or the screen?
No, it's attached to the computer.
So we can't put it on that first?
I don't know. That's how IT told me to set it up.
Oh.
So they take one of each of these?
Yeah.
Well, I don't, if you've got the time and you just want to take one of each of those and put them in, like you said, a packet, I don't have an issue with that. I think that is a little more streamlined.
Yeah.
Again, I don't know the order either, so.
Yeah, I don't want to mess up with the order.
Yeah.
We have another speaker, but someone took the cable. I cannot find the cable. They just gave it back to me with no cable.
Could we do the projector instead?
No. No, we cannot project. It's just it's too low. Yeah, they use it.
IT assist, is Tony around?
I just called Tony, he's not answering, and I was just talking to this lady over there on IT. I think she's confused.
Okay, can we call Andy? And Andy maybe assist?
Let me ask him. I think I have Tony's.
His cell number? Yeah, because I called his office, he's not answering. He's not answering.
Hello there. I'm assuming you're my subject matter expert on all things with this video conferencing in the training room. We're having trouble getting the volume loud enough. We have a Board of Health meeting in here and hang on, let me put you on speaker.
Okay.
Okay.
Do you have the TV remote in your hand?
TV remote?
Yes.
Okay.
You have the monitor turned on?
Yes,
Okay, on the side of the remote is the volume button.
it is all the way up.
It's all the way up?
Yeah, it's at 100.
Well, okay, so it depends on where you told the video conferencing sound to come from or go to. Are
Oh,
you,
how do you fix it?
do you also have the mic plugged in, the external mic?
I do.
Okay, so are you on Zoom or Teams?
I'm on Teams.
Okay, I don't know, I would have to get into Teams and try to figure it out. I know how to do it in Zoom, but probably in Teams, there's going to be some setting somewhere that says basically where are you connecting? Where's the audio going to and from?
And so where do we want it to?
We want it to go to the computer, because then it'll come out of the TV and it'll be louder.
Okay. All right, well, we'll troubleshoot that a little bit.
Okay.
Okay, so you do it through the settings in the actual system and not the equipment here.
If I had to guess what the problem is, that's probably what it is.
Okay.
It's that the sound is pulling from somewhere else. It's yeah.
Okay. All right. Well, we'll play around with that. Thank you.
Oh, okay. All right, sure.
Thanks. Bye.
Yeah. Speaker. Audio devices are set up. So we have the snowball right here. That's what it's showing. But it's not. Do you see that it's full?
Can you? What if you do the
It's not going.
other options?
The webcam.
How do you test it? Is noise suppression? Just the speaker drop down. So how do we test it? Since when you change it to something else, how do we do a test?
Brittany, can you join, please?
Yes, and it already looks like some of the health board is here.
Really?
But I guess one already arrived. But I haven't gone and picked him up yet.
Oh, can you please score him in?
Okay, I'm gonna also jump on the meeting right now. So
Already
the
left.
number-
Hello.
Come on. Yeah, you need to score the person, please.
Okay.
But basically, can you mention what's going on? Oh, but they're saying but is that not?
Do you want to?
Oh, yeah, sorry, I was.
Thank you, Brittany.
Yeah, is it good?
Yeah, it's much better.
Oh, okay then. Do you want me to go ahead and take the person back there now?
Yes, please.
Okay, on my way.
Thanks, bye. Should I move it or just leave it like that?
Because it's already recording.
So it's the Intel R display audio. And as a microphone, we have this one. Oh my God. So happy. Okay, so what do you want me to do? This section.
I don't know, I mean, if it's got a minute to call, is it autumn?
Yeah.
Up north and kind of, if there is a, but at this point, you're gonna have people starting to trickle in probably any minute now. So yeah, if you wanna call her real quick, just to, I don't think it's a huge deal. Yeah, and maybe if we host future ones, if we can get a table of contents and we can set them up in a binder about.
Yeah.
There's so many agendas that you can even tell people. Good morning.
Good morning. We have our sign here.
Just trying to figure out how to streamline the paperwork. Sure. Wait a little bit.
Good morning.
Do we have folders for folks, but they not just much
I can be Trump.
yeah.
So is there, we're supposed to take a little bit of everything?
I think,
Yeah, they sent it to us like this, and I just didn't want, those like all in the box.
we don't have the orders set, so yes, you're supposed to take one of each.
So this is the meeting agenda. See what I'm seeing. These are the minutes for the last one, and the rest of the stuff of the test minutes. We think some folders. No, thank you so much for your time.
I don't know if we should have this, speaker this way.
Well, I think you have to have that one close enough to the folks in this room. We'll just need to not have people walk that way.
Okay.
Yeah, I don't.
And is there Wi-Fi?
There should be.
You need the Wi-Fi password? I do. Which, is it just DHHS?
There are two.
Okay.
No.
And the password is that. There's one in here.
You said Wi-Fi,
Uh-huh.
DHHS,
The next one.
this one?
Someone just write it down. I was gonna get Manila for it, but there's no one in the.
Sorry?
Are you gonna be in the office next week?
Yes.
Okay, great. I just saw Autumn's email about the appeal from that guy. So I'm responding to her email now. So let's just plan to like, you and I can discuss internally early next week and then we can.
Okay. All right.
Good morning. How are you?
Good, how are you?
Good. I brought the new placards that Joseph sent me.
Thank you.
Yes.
Fancy.
Yeah, they're nice looking.
Okay, that's it here?
Yeah.
How was your flight?
It was good. Easy.
Early.
Early, it was full flight.
Really?
It's a holiday weekend, so
That's true.
that checks out. Yeah, it was early, not as early as last time though. I think I was on like a 5:30 flight last time. This time it's 6:30, so. It's okay. Yeah, of course.
The attorney letter for public comment for the Meadows School, that has nothing to do with the sky. Or the one we heard last time.
Right, the one that there were some emails about last night, is that right?
There were emails last night, I didn't see that.
I
I mean, I sent an email on the question.
Okay, so not related to that. Let me look. I don't know that I know.
I'll show you that.
Oh, I know it's, no, it's not related.
Okay.
It's the same issue, but it's a different, it's involving different people, so it doesn't have to do with the variance.
It just was public comment, it's not gonna come up.
Yeah. And I informed him that he's seeking a variance, he needs to apply through the proper process. So I don't know if they'll hear and provide oral comment or not.
Just wanna stay on pretty good. Yeah, and then she answered my email last night, I was confused about The other public comment about that other statute or whatever, I didn't see it anywhere on our agenda. What are the other emails other than that?
No.
Other than mine?
No.
Morning.
Morning.
How are you?
Fine.
I wonder. You still have to do it's already submitted, but same thing. I mean, he wants a variance so that when the permit program is regulated, he not in advance. It's already in the consent.
But, so this is a regulatory change. So let me see, where's the variance?
This is a consent agenda. Right here, A68. I need to do.
Yeah, but if the variance gets approved today, then he can start today. The regulations will have to go up to the legislative commission.
deal, we hook in,
It was so too. We got a little bit of time.
Yeah, Dr. Larson said, well, he's been here before.
And I don't know, I can't see if he's on.
Person said fire department,
Judith Bittner.
that says autumn black, that must be autumn. But he's not autumn.
Yeah. Yeah, oh, yeah, same, I have a better.
There he is.
Hi.
Good morning.
Smith is right behind me.
Good, how are you?
Don't go around. Just pull up the comment, 'cause it would be
Yeah.
Just a little bit. What happened if they close the front door? So we have to go through the clinical barricade to get.
Yeah.
So. Didn't know they closed the front door. Okay.
Start reading. Yeah, I mean, looking at what you're talking about. I would.
Concern that he brings up is really more saying, I'm challenging the statute, which says on affirmative public choosing.
Yes.
That's not a variance, that's a legal challenge to the statute. I don't want to fill out the form, but nowhere in the variance does it describe the special need.
So so let's
That attorney is for not only.
Oh, that's not
He's not that guy's attorney.
Okay.
Yeah,
All
I
right.
can clarify that if we have
Okay.
questions.
No problem. Okay.
Yeah.
So the variance one is like, I just don't want to fill out the form.
Right. And we Bueller. Bueller.
Good morning up north. Can you hear us?
We can hear you. Can you hear us?
Yes.
Yes, we can hear you. Thank you. Are you all set up north? It looks like you're moving furniture around.
Good morning, everybody. Can you hear us?
Yes, we can hear you. Thank you, doctor. If you can hear us, I'll go ahead and open the meeting.
Can you turn it up a little bit?
What's that?
Can you turn it up?
Their voice.
Microphone up there.
I don't know, I think it's attached to this,
Yeah, it's on that.
and that's as long as that goes. Can you hear us better when we're closer? Okay, I don't know if we want to move. We could put.
Yes,
chairs-
if you could get closer to that microphone would be better.
Okay.
I'll just put this, we're gonna have to, or we can just try to, scoop. But I'm wondering if I move the mic and we all scoop down, if that's gonna work. If it will move any.
I'll go to the beginning.
Yeah. Get us this close. We just want to be on the camera, which is the hard part. So let's see, where's the cell phone? It's at the bottom corner? Yeah. Okay, see, so I'm the end of, I think this is the end of the.
End of it.
Yeah.
Do you want me to sit here, or I can even go, because I don't necessarily need to see.
Yeah, that's fine.
Why don't you try now?
Maybe we can just turn it a little bit more. Someone comes in, we can adjust it. That makes sense.
Well,
And keep a little bit more this way.
Can you hear us in Carson?
Yes, we can.
All right, I think we're ready. Good morning. I'd like to call the State Board of Health meeting to order on September 2nd, 2022. Welcome, everyone. Thank you for attending today. I'd like to introduce and welcome Ms. Autumn Blattman, our new executive assistant. We appreciate all your hard work. I know you had to do a lot to fill Joseph's shoes, and you did a great job, so thank you very much.
Thank you.
May we have a roll call, please?
Yes. Dr. John Pennel,
Here.
Jeffrey Murawsky,
Present.
Monica Ponce. Don't believe she's online. Okay. Dr. Larson. Judith Bittner.
Present.
And Mr. Smith.
Present.
Okay. And I believe we have quorum.
This is Dr. Ponce. I'm present.
Thank you.
Thank you very much. On our agenda, action item 2 is approval of the meeting minutes from June 3rd to 2022. Anybody have any addition or corrections to the June 3rd minutes? Chair has one small, I think it was a cut and paste there on the bottom of page 8. It says after Dr. Ted McDonald's report. It said Dr. Azam gave a brief overview of his report. It's already entered earlier if you can strike that. Any other additions or corrections? Is there any public comment? Go ahead and call for the motion.
Go ahead, Carson City Fire Department.
Good morning. This is Sandy Warko with Carson City Fire Department. I'm the Division Chief of EMS. And I just want to make public comment on 2 items on the agenda. The first item.
I'm sorry, I failed to make an announcement about public comment. We're just on the minutes right now.
Oh.
We're on the minutes right now. We're not at that part of the meeting.
Sorry.
Yeah, it's my fault. I should have gone into public comment. So public comment will be allowed, and it is specific to each agenda item. If you have a public comment not related to an agenda item, we'll give you a chance at the end of the meeting that anything can be brought up during that public comment period. And so I apologize to you. That's my fault for not bringing that up. We encourage public comment, but any behavior that is not respectful, your public comment would be terminated. So we're back to the minutes. May I have a motion concerning the minutes for June 3rd, 2022?
It's Dr. Murawsky. I'll make a motion to approve the minutes with the amendation submitted by Dr. Pennel.
Carl Smith, second.
Moved and seconded. Is there any additional comment? All in favor of approving the minutes as amended, please say aye.
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 Any opposed? Any abstention? Motion carried. The minutes are approved. Next item is informational, and we'll start out with our quarterly county and health district reports. First up is Carson City Health and Human Services, Dr. Colleen Lyons and Nikki Aker. We can't hear you. Dr. Lyons, we can't hear you.
I'm here in Nikki Aker's stead. She's on a much needed vacation, but attending to family matters as well. So I'll just go over some brief things from the report. On COVID-19, we're collaborating with the community health nurses in the Quad County area to offer those COVID vaccines to children under 5 in a more individual clinical setting where the parents can ask more questions, and hopefully those vaccines can be successfully administered and encouraged. Under clinical services, I want to point out a significant struggle. We have been able to provide same day and next day availability for family planning. So if someone were to call requesting contraception, counseling, advice, prescription, that sort of thing, we can see them that day or the next day. Unfortunately, that funding at the federal level, while it stayed steady as it trickled down to the state, has now been diverted to federally qualified health clinics. And so our funding got cut considerably. Here in Carson City, we are concerned that while the federally qualified health clinic has offered the service, they haven't had a dedicated provider as we have, and we are concerned about maintaining that same day, next day access. So if anyone can help, we're going to be revisiting the funding allocation during the non-compete application in December. We have 2 local physicians who are working, have contacted our federal representatives in terms of this and working on that. Next, I would go to the chronic disease and report that we'll be meeting with our school board. We meet annually with the school board at our one of our Board of Health meetings quarterly. and we'll be addressing the sexual risk avoidance education, personal responsibility education program. Those are courses consisting of 8 one-hour sessions. They can be done in 2-hour sessions, but obviously that standard classroom was going to be a 1-hour session. Since COVID, we've not been able to get back into some of our schools. And so we hope that we can help facilitate that at that co-meeting with the school board. Subsequently, I would report that we now have a separate environmental health division manager. She started in the first part of May. She's bilingual and is looking at getting some programs in both English and Spanish for pool operators and for food safety managers. That division has begun to accept online payments in terms of a customer service benefit. And regarding monkeypox, we have no confirmed area cases so far in the Quad County region. And our Ron Wood, I think I have that right, outreach case manager for our HIV has put information out on the monkeypox to those respective clients. We note here in the Carson area that we are already seeing significantly more hospitalizations in the second quarter of this year at 58 influenza hospitalizations compared for 36 for all of 2019. The Human Services Department, well, the entire department is converting to a trauma-informed agency, and in the Human Services area, they're converting a conference room to an interview room in more of a family room style setting with calming features, and that is a space that could potentially be used by employees themselves also to decompress if needed. In this section, not in this report was submitted to our Board of Health meeting just a few weeks ago. At that Board of Health meeting, I'm glad to report that the Board of Health recommended to our Board of Supervisors that they pursue the housing and sheltering plan for the homeless that has been worked on over several months in the Behavioral Health Task Force, along with multiple partners within the Carson City area. And that plan starts, and probably one of the key components is a street outreach team to actually connect people on the street homeless to services, and then consideration for group housing and individual room facility, but all with case management and an expectation of independence, ultimate independence. So that was a win for the health department, coordinating that, putting that forward, and the Board of Supervisors looking to truly flesh that plan out to start with the street outreach. On Public Health Preparedness Division, they are revamping the Western Nevada Medical Service Corps operational capabilities and situational specific training for the volunteers, such as mass care, sheltering, and dispensing pod activities. In addition, they have put together information on monkeypox, clinical information, and that has been distributed to all our primary care sites and dermatologists, et cetera, in person by staff of both epidemiology as well as preparedness. And they'll be doing additional outreach to our adult entertainment industry and the hospitality workers, as well as outreach for employers of migrants and transient workers to encourage that, to discourage them from sharing clothing or linens. And in that department, we've had trouble hiring people to provide the vaccines at our COVID clinics. So just another example of the medical staffing issues throughout our entire medical system. We are near completion for our third community health needs assessment. We've been collaborated with Carson Tahoe Hospital, which serves the Quad County area and the southern part of Washoe County, and that collaboration has been going very well to include getting contacts and knowledge for that next step, which will be our community health improvement plan. And that concludes. Are there any questions?
Thank you, Dr. Lyons. Are there any questions from board members? Any public comment? Next on the list, thank you, Dr. Lyons. Next on the list is Washoe County Health District. My understanding is Mr. Dick is not available today. His report has been entered into the record. Is there anybody from Washoe County that was going to give a verbal report in his place?
Dr. Pennel, I don't believe anybody is representing Washoe County.
Thank you. Next up, Southern Nevada Health District. They have Dr. Lockett.
Yeah, good morning, board members. Can you hear me?
Yes, thank you. We can hear you down.
Oh.
Here.
Yeah, thank you for having me here today. Dr. Ligon has been redirected to do some other things, so I'm just subbing in. I don't really have a big report to give you. I'll focus on the current activities around COVID and monkeypox, but right now in our jurisdiction, we're still seeing that what's dominant currently is BA.5 that mirrors what's happening in the United States in terms of the current variant circulating. Trends, however, this is good news, continue to go down every single day, which is encouraging, and as we can attempt to control the spread. And right now, in terms of what CDC, if we try to look at our measures and compare to CDC, we're in moderate. We've been in moderate transmission, I would say, since August the 23rd all the way until today. And that's using CDC's community transmission metrics. What's really tell you more about your individual risk in a community, not the community level. Our community level, which has mostly is looking at impact in healthcare, those metrics basically say that we are low. But what's really driving everything, if you go look at CDC community transmission for Clark County, you'll see it's high. What's driving that is our test positivity rate. That's what's driving that. It's hovering today around 12.5%, but it has been coming down. It was about 20% a few weeks ago. So we're seeing significant improvement. We would like to see that below 8, and that will put us in moderate transmission along with our case rates that continue to decline. And then hopefully CDC can put us in moderate transmission or even low in the future. That would be great. Last week, we have been looking at some of our case data as well and see if we have any novel other variants emerging. And we noticed that we do have a BA.4.6 emerging in a few cases. It may take over the current variant BA.5. This may also be true in the United States, but may not cause another wave. But we are trying to pay attention to these things clearly, and we're trying to wait to see if all of us are going to get our hands on for vaccine, the new bivalent vaccine from Pfizer for 12 years and up, and Moderna for those individuals age 18 and over. So we're waiting to see how soon the CDC director is going to sign off on that so we can get that vaccine and start administering that as soon as possible. In terms of testing around COVID activities, we have these public health vending machines that we strategically have placed in specific locations. They basically have home test kits in them. They are used heavily. We probably expend about 500-600 a week. Right now, we have a new location. We have one over at Laughlin Government Regional Center. We have one at our Bonneville Transportation Center, and then we have one over at Mesa View Hospital in Mesquite. And we're looking to expand. And so we're looking at our local epidemiology to see if we can do more because, as you already know, some of these testing companies now are starting to pull out of local health departments across the country, and that's a little different with us. So some of our locations that have closed down involve some of our library sites and recreational centers. However, we're still keeping some of our mobile testing services over at Enterprise, Whitney, and Sahara West. So we still will maintain a presence so people can get the confirmatory test via, PCR. So that's still available at those 3 sites. But we are expanding home test kits through our vending machine program. So we're looking at potentially adding another 5 to 7 sites there. And by the way, CDC really likes this program and thinks that for some reason that this vending program is probably going to end up being the best practice. And they really want us to do a lot more with this program with the grants that they've given us. So we're exploring and trying to do more there. In terms of monkeypox, well, I think the last time I checked, we had about 166 cases of monkeypox in Clark County, and that continues to grow slightly. I don't know if you know, but most of the cases are between the ages of 25 and 44 years, so about 72%. And we have some disproportionality. So we need to explore vaccine data to determine what that looks like. And we're in the midst of doing that. We have found some disparities. For example, African-American men make up about 25% of cases, but 10% of the population, but only 6% of those individuals who have been vaccinated so far. So we do know we have some vaccine gaps that we need to work on, and we're trying to march towards doing so. Also, we've been working with our partners to make sure that they can access any kind of treatment we have. And so it's as simple as writing a prescription to our pharmacy, and local providers and facilities in the area in Clark County can get treatment from us. We've actually also gave certain facilities treatment, certain number of doses so they can have those on hand. We are also continuing to kind of redirect some of our staff as investigations increase. We have to redirect staff from other work to handle those investigations, so we're doing that. And we put together a comprehensive monkeypox budget to submit to the CDC of about $3.2 million to deal with treatment, investigations, and vaccination and tracking of monkeypox, and to hold monkeypox campaigns. And so we're still waiting for CDC to approve that. That also contains an allotment for to purchase additional syringes, so we can continue to do our intradermal injection program and try to get at least 5 of those out of each vial. So that's pretty much all I have today. Any questions?
Thank you, Dr. Lockett. Any questions from board members? Appreciate the information, and I had not heard about the vending. Sounds like. Thank you, sir. Next up, State of Nevada, Dr. Azam.
Good morning, and it's nice to see everybody. And you have my report. I'm Ted McDonald, the Community Health Officer for Mineral County and Churchill County, and the Medical Director for Churchill County Health Department. You have in front of you my report, and I'm just going to provide to you some of the updates since that report. The Central Nevada Health District project is ongoing. We had a chance to meet with the Internal Finance Committee August 17th. And they have provided us the go-ahead to continue to work towards having a Central Nevada Health District, which was a big step for us. And at this point, the counties are continuing to work on making sure that we have Medicare and Medicaid recognition and develop our policies, procedures, make sure we outline our staffs and have the resources to be able to meet our goal of having a health district established by June of 2023. We are also preparing for our vaccine season. We've ordered our flu vaccines. We've ordered our bivalent COVID-19 vaccines, and we're just waiting for the final okay. We've already scheduled pods for vaccinations for Churchill County, Mineral County, Eureka, and Pershing counties. We have them available. We'll have them available at our senior citizens. We'll have mobile units. We are also working with the school district for their needs. School district has gone back to school and has done well. We've had no issues. We're currently actively using the Novavax vaccine for those patients or clients that are vaccine naive, and we're using that as an alternative for those folks who may have concerns about messenger RNA vaccines. Our cases in Churchill County have dropped to where we had one incidence August 23rd. We follow the pattern everybody else has. Our peak was in mid-July, where we had 87 active cases in one day. We've had 3 or 4 hospitalizations. We have a historic death that was assigned to us from 2021. We have had a presentation from Gerald Ackerman regarding the state of Nevada county health ratings. Churchill County has had a decrease in our rating that has been passed on to the Board of Health. We'll be using that in our community needs assessment and our planning for the next year. Mineral County has had its second meeting of the Southern Nevada Behavioral Health Task Force, led by Kim Donahue, who is the Regional Behavioral Health Coordinator. They had a meeting last month. The initial meeting was a SWOT analysis, and this meeting, we'll have another meeting coming up in September 8th, and we'll continue that process, evaluating the needs for Southern Nevada District of Behavioral Health. I would also like to say I love the idea of the vending program, and I am going to present that to our Board of Health and to our folks here. And I think that's an excellent idea, given that a lot of the organizations now are moving away from providing free testing kits. That is my update on my written presentation. Are there any questions for me at all?
Thank you, Dr. McDonald. Any questions from board members? Okay, next up, Dr. Zam, the state of Nevada, please.
Good morning, Mr. Chairman and esteemed members of the board. Good morning, everyone. For the record, Aizen Azam, State Chief Medical Officer. Can you hear me?
Yes, we can, loud and clear.
Thank you. So you already have a copy of my report, so I will just summarize and update most important points. I will start with the monkeypox global outbreak, then we'll update you on the status of the COVID pandemic, and we'll close with a brief update on influenza. There are some early signs that rates of new monkeypox infections are slowing down in some major cities, including New York, Chicago, and San Francisco, where pox virus cases were initially detected in the US, then rapidly spread nationwide. However, the outbreak is not yet contained neither in the US nor globally, as numbers are still increasing, but at a slower rate. As of yesterday, the global case count of monkeypox was about 52,000 cases, with more than 51,000 occurring in countries that have not historically reported monkeypox. Although there have been a total of 6 deaths reported in Brazil, Spain, Ecuador, India, and Nevada. There was no death yet in the US. As of yesterday, about 19,500 confirmed cases of monkeypox were reported in the US, and as I mentioned, there's no death. As of yesterday, Nevada had 182 cases of monkeypox, and as Dr. Lockett mentioned, 166 of those are in Clark County, 14 in Washoe, and 2 in rural and frontier Nevada. Although monkeypox cases in the US have been reported in men who have sex with men, the virus can be transmitted through close contact that doesn't have to involve sex. Using the Jynneos intradermal vaccine for post-exposure prophylaxis among those who could have been exposed and proactively administrating pre-exposure prophylaxis for individuals and groups at high risk for exposure to monkeypox seems to have been slowing down the incidence rate in Nevada and nationwide. Now, a little about the COVID pandemic. Early in August, the National Centers for Disease Control and Prevention made substantial revisions to their COVID-related guidelines. Even though these much relaxed guidelines were comprehensive, they didn't seem to have been generated based on significant changes in the status of the ongoing pandemic. Omicron subvariants are still circulating across every state. Incidence, hospitalization, and COVID-related death, even though are slowing down, they are still too high and seem to have been plateauing for several months. Around 100,000 newly confirmed COVID cases and 350 deaths in the US every day continue to cause major concerns for the public health systems. Now, for more than a month, the moving average of confirmed COVID cases in Nevada was gradually decreasing, and week-to-week decreases in caseload and hospitalizations ranged from 10% to 23%. Yesterday, the average daily number of COVID confirmed cases in Nevada was 271 cases, with only 192 confirmed and probable COVID cases remaining hospitalized. Since the beginning of the pandemic, 11,400 COVID-related deaths were reported in Nevada, with a moving average of 1 COVID death per day. Nevada seems to be lagging behind the nation with vaccination rates. About 65% of Nevada residents have initiated their vaccination, but only about 56 completed the vaccine series. The Food and Drug Administration and the Advisory Committee on Immunization Practices, ACIP, just authorized the first updated Pfizer and Moderna versions of the COVID-19 vaccine since the pandemic began. These new boosters are, as you heard, bivalent vaccines that are designed to protect against the strain, which is the original strain, and the highly contagious Omicron variants, specifically targeting the BA4 and BA5 Omicron subvariants, which are the dominant variants currently circulating in the US and worldwide. It's important to emphasize that these updated boosters do not replace the initial vaccine series. It is expected that the new bivalent COVID vaccine or the booster has the potential to prevent 130,000 hospitalizations and 10,000 COVID-related deaths. The new bivalent booster can be administered at least 2 months after the last booster. Now the status on the seasonal influenza. Influenza A has been the dominant type in Nevada and nationally, and almost all hospitalizations and deaths were due to influenza A. During this influenza season and post-season, Nevada had 721 influenza-related hospitalizations and 11 influenza-associated deaths. Both the seasonal influenza shot and the new bivalent booster for COVID are highly effective in preventing and reducing severe complications, hospitalizations, and death due to COVID and due to influenza. Both these vaccines are highly recommended before a potential surge in COVID-19 cases and the start of the influenza season as cooler weather arrives in the fall. With this, I'm concluding my remarks and will be happy to answer your questions. Thank you.
Thank you, Doctor. Any questions or comments from board members? I'd like to thank you for mentioning animals in your report on monkeypox. Of course, it is a zoonotic disease, and this is quite different than the outbreak they had in 2003, which seemed like it was quickly contained. So thanks for all your work on that. We have a number of reports from other health district officers that have all been entered into the record. Are there any other county health officers that would like to make verbal comments? Okay, hearing none, we'll move on. Thank you. Next action item is item number 4. Earlier, I should have also mentioned that today's agenda was posted in accordance with Nevada Open Meeting Law. Discussion and possible approval of variance number 732 regarding requirements of R046-20AP, religious exemption to vaccine objections through form submission and written statement, and a request for the waiver of submission of form for vaccination exemption requested by Mr. Jeremy Mancuso. May I call on Mr. Kyle Devine, please?
Good morning, Dr. Pennel, board members. I am Kyle Devine, and I serve as the Chief of the Bureau of Child, Family, and Community Wellness. Thank you for hearing variance requests number 732 from the Nevada Administrative Code 392 as amended by LCB file number R046-20AP. Relating to student immunization exemptions, which was submitted by Mr. Mancuso on January 31st, 2022. This request was brought before the board at your last board meeting on June 3rd. As a reminder, Nevada Revised Statute 392.437 provides that a public school shall not refuse to enroll a child as a pupil because the child has not been immunized pursuant to Nevada Revised Chapter 392.435 if the parents or guardian of the child has submitted to the Board of Trustees of the school district a written statement indicating that their religious beliefs prohibits immunization of such child. LCB file number R06420AP amended Chapter 392 of the Nevada Administrative Code requiring the parents or guardians' written statements be submitted on a form provided by the Division of Public and Behavioral Health. Mr. Mancuso filed this variance request asking to not use the standard form provided by the Division of Public and Behavioral Health as required. After the last board meeting, we discovered that although the applicant was sent notice of the meeting, including the agenda, the staff report to the board was not included as is required by Nevada Administrative Code 439230. To assure Mr. Mancuso had all pertinent information to respond to staff's analysis and recommendations, staff attempted to call Mr. Mancuso to obtain contact information. As staff received no reply, on June 28th, staff did email notice of this meeting along with the report to Mr. Mancuso so that he would have all information and be able to present at this meeting if he desired. As staff did not receive the response, we believe that Mr. Mancuso may have received the information through the email. And as such, staff continue to believe that the utilization of the standard form does not cause any undue burden and continues to recommend the denial of this variance. Thank you.
Thank you, sir. Any board questions, board member questions or comments? Is Mr. Mancuso on the line? Is there any public comment on this? Hearing none, I'll call for a motion on possible approval, on discussion of possible approval of variance.
Dr. Murawsky, I motion to deny the variance number 732 on R406-208P, religious exemption to vaccine injections.
Paul Smith, second.
Been moved and seconded. Is there any discussion? The motion is to deny the variance. All in favor, please say aye.
Aye.
Aye. Aye.
Any opposed? Any abstention? The variance has been denied. Agenda item number 5, discussion and possible approval of variance number 734 regarding requirements and precautions regarding safety from fire and NAC 449.211 and NAC 449.229 submitted by P. Teresa Brushfield. May I call on Mr. Grillman, please?
Good morning, Mr. Chairman, members of the board. For the record, I'm Steve Grillman, Health Facility Inspection Manager for the Bureau of Healthcare Quality and Compliance. I'm presenting case number 734 for P. Teresa Brushfield, RFA et al. Obtained variance to Nevada Administrative Code 449-211 and Nevada Administrative Code 229, which requires compliance with the residential facility for groups fire safety codes to include fire sprinkler systems and fire alarm systems and its components per the regulations adopted by the State Fire Marshal pursuant to Chapter 477 of the Nevada Administrative Code, and all local authorities having jurisdiction. Ms. Brushfield was indicated that a number of the residential facilities for groups that she is associated with are experiencing marketplace difficulties due to supply chain delays for obtaining parts related to the installation of fire sprinkler systems and communicating components of the fire alarm systems. The Bureau of Healthcare Quality and Compliance acknowledged supply chain delays exist and that a number of different providers are experiencing similar delays, such as obtaining fire sprinkler heads and delays with fire damper actuators. Fortunately, these delays were limited to a few weeks at most. However, ordering an emergency generator can take months. Ms. Brushfield and her affiliated residential facilities for groups solution is not to be held to the fire safety standards by not providing fire protection to the residents with early detection, early notification, and fire suppression, and enabling the occupants to leave the building. Their solution is not acceptable. The trade-off between the market delays and the no fire protection for 3 or more elderly and disabled residents is a risk that must be avoided for all occupants within the residential facility for groups' homes. Once the residential facility completes their license application, the Bureau of Healthcare Quality and Compliance makes a request to the Nevada State Fire Marshal to conduct their survey to satisfy both their Nevada revised statutes and Nevada administrative codes for the residential facilities for groups, which would also satisfy the Nevada Revised Statute 449.307 requirement for licensed healthcare facilities for the Bureau of Healthcare Quality and Compliance, especially for those non-Medicare certified facilities like residential facilities for group. The state fire marshal approval probably would not be granted if the fire sprinkler system or the fire alarm system are not installed or installed but not working. The state fire marshal uses the International Fire Code for all state licensing facilities, and the Bureau of Healthcare Quality and Compliance uses the National Fire Protection Association standards to match Medicare requirements for reimbursement. There are both some common and non-common requirements between the IFC, International Fire Code, and the Nevada, or the National Fire Protection Association standards. The Nevada Board of Health and the Division of Public and Behavior Health cannot speak on behalf of the state fire marshal's position, whether they can accept or approve, because they're an independent agency. Ms. Brushfield has suggested that there's a high demand for residential facilities for groups. This should be the impetus for getting affiliated residential facility groups open without functioning fire protection features. The Bureau of Healthcare Quality and Compliance has empirically been reported to and from both internal agency sources and external sources that census rates have been low in the recent times, as indicated in the variance memorandum. Quantitatively, there is no real-time way to collect facility census for residential facilities for groups. However, the Bureau of Healthcare Quality and Compliance does have their surveyors collect census data mainly for residential facilities for groups and skilled nursing facilities. All residential facilities are surveyed once a year, which is required by Nevada Revised Statute. Review of the statewide residential facility for groups statements of deficiencies, which include each residential facility for groups census data and compared against their licensed number of beds for the fiscal year 2021, which is between 7/1/21 and through 6/30/22, revealed that of the 390 licensed residential facilities for group during that time period had 70.5% occupancy rate, or restated, there was a 29.5% vacancy rate. The Bureau of Healthcare Quality and Compliance is empathetic towards all facility types during these recent and trying times, and we'd like to see all prospective facility operators be successful in getting license and after obtaining their license. However, the Bureau of Healthcare Quality and Compliance also must help ensure that residents, patients, clients, staff members, visitors, even owners and operators are providing and receiving proper care in a safe and protected environment. The primary reason for the state agency cannot support the removal of the residential facilities for groups fire safety code is the risk for the resident in an unprotected home. The Bureau of Healthcare Quality and Compliance did notify the variance applicant that the agency would not be able to support their variance request and would be recommending to the board to deny variance case 734 to allow not to meet the residential facilities for groups fire safety codes 449.211 and 449.229. At the time of this notification, we were open to discuss other alternatives. We have not heard anything from the variant applicant since the notification in July 18, 2022. The facility has I'm not sure if the facility has representatives present. Pursuant to your questions, this concludes my presentation.
Thank you, Mr. Grumman. Are there any questions from the board? Is Ms. Brushfield in attendance? And if so, does she wish to offer testimony? Okay, I'll open for public comment. Public comment is for this specific agenda item and is limited to 2 minutes. If we do have public comment, the clock will be started so that you know how much time you have left. Is there any public comment? Hearing none, I'll call for a motion on.
Chairman, if I may, I'd like to make a comment.
Please do.
As I'm in the industry, I understand the issues related to supply chain and delay on materials, but in my opinion, this is a life safety issue. And the risk of fire may be low, but the risk exists. So, from my standpoint, a construction site, it's a hard thing on the owner to get these operational, but I don't think it's to forgo fire protection facilities. Thank you.
Thank you. May I have a motion, please?
Charles Smith, I'll make a motion to deny the request as recommended by staff.
I'll second Dr. Murawsky.
Been moved and seconded. Any discussion from board members? The motion is to deny variance 734. All in favor, please say aye.
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 Opposed? Say nay. Any abstentions? Motion carries. Variance is denied. Next up is our consent agenda. Are there any requests to remove items from the consent agenda?
Okay, can we pull off item
7? Aye.
I from the consent agenda for vote? Approval compliance agreement pursuant to NAC Chapter 652, Subject 7 of Sunrise Hospital Medical Center POC testing lab.
Okay. Agenda item II has been pulled from the consent agenda. Are there any other items to pull from the consent agenda? Is there any public comment on pulling agenda items? Okay, we'll go ahead with the consent agenda as amended by removing agenda II. Call for a motion.
This is Dr. Murawsky. I'll make a motion to approve the consent agenda without item II.
Charles Smith, second.
It's been moved and seconded. Is there further discussion? All in favor of the consent agenda as listed, please say aye.
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 Any opposed? Any abstain? Motion carries. We'll move on now to, the consent agenda has been approved. We'll move on to item II, approval of compliance agreement pursuant to NAC Chapter 652.397 at Sunrise Hospital and Medical Center, POC testing lab, license laboratory license 2880, permitting certified nursing assistants or students enrolled in an accredited school of professional nursing or graduates of such a school pending the results of the first licensing examination scheduled by the State Board of Nursing following graduation, licensed in the state of Nevada, to be qualified to apply for and obtain a point of care analyst license and perform waived glucose testing in their healthcare facility. Is Bradley Waffles available?
Jim, John, Bradley, wait.
Just on the record. Yeah, just hold on a second. Yeah. Yeah, so I just, as Dr. Murawsky, for public comment, I needed to remove item II as I am an employee of the same company that owns and operates Sunrise Hospital and Medical Center, and therefore I abstain from voting on this measure.
And this is Karen Takis, Deputy Attorney General. I just want to note for the record that this is a disclosure and extension required by NRS Chapter 281A. And Dr. Murawsky will abstain from discussion and vote on it.
Okay, sir. Thank you.
So this is just to allow for need for certified nursing assistants or students that are enrolled in an accredited school of professional nursing be able to assist the nursing staff with providing figure-stick glucose testing and allow the nursing staff to focus on other areas of patient care. And so this was a need that was spoken to us from many different healthcare facilities, and this is trying to assist in their needs.
Thank you. Any questions from the board members? Any public comment? May I have a motion, please, for II on the agenda?
Charles Smith, I make a motion to approve the item II, approval of compliance.
Dr. Ponce, second.
Been moved and seconded. Further discussion? All in favor of approval, please say aye.
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 Any negative? Any abstention?
Dr. Murawsky, abstention.
Dr. Murawsky abstained. Motion carries. Thank you. Agenda item 7, consideration and possible adoption of proposed regulation amendments to chapter 457, 459, 449, and 652 of the Nevada Administrative Code NAC relating to Assembly Bill AB 471. Proposed regulations establish certain fees to support the system for the reporting of information on cancer and other neoplasms, authorizes certain healthcare facilities and providers of healthcare to abstract or report information to the system, and clarifies language regarding the administrative penalty for failure to correctly report information on cancer and other neoplasm. LCD file number R010-22. Andrea Oguchi.
Yes, thank you. Good morning, Board of Health members. My name is Andrea Oguchi, and I serve as the Program Manager for the Nevada Central Cancer Registry. And as you mentioned, today I will be presenting R number 010-22 for your consideration. These regulations were developed by the Division of Public and Behavioral Health, working with stakeholders, including the Nevada Hospital Association and the Nevada Rural Health Partners, to amend Nevada Administrative Code chapters 457, 459, 449, and 652. I will now proceed to walk through the changes made. The proposed changes to NAC added a fee of 6% of the renewal fee for the licensure renewal cost for mammography, other radiological machines, surgical center for ambulatory patients, facility for the treatment of irreversible renal disease, facility for hospice care, program of hospice care, facility for intermediate care, facility for nursing, skilled nursing, agency to provide personal care services in-home or rural clinic, and renewal of licensure to operate medical laboratories, except for laboratories that only perform waived human immunodeficiency virus testing, HIV. The proposed changes add language to clarify the definition and demonstrate the difference between a report and an abstract, which is the terminology used in referencing the format in which cancer case data is submitted to the state registry. Additionally, the regulations also provide a methodology to clearly and easily determine if a facility is required to submit an abstract or a report based on the definition included in the amended regulations. Proposed changes add language to expand the authority of the Nevada Central Cancer Registry to enforce cancer reporting requirements for providers who not only diagnose and provide treatment, but also refer a case of cancer or other neoplasm. Proposed changes remove confusing language concerning the term initial diagnosis and clarify the requirement for submitting a report or an abstract to be only active or newly reportable diagnosis as defined in the amended regulations. Lastly, the changes in the regulations add clarifying language to further describe the intent behind the current non-reporting fees in NAC and increase the time allowed for corrective action to submit an abstract or report on cancer or other neoplasms. A public workshop for the proposed regulations was held on May 26th, 2022. 2 members of the public offered comment. 1 member asking for clarification if their facility is actively reporting currently, and another caller in favor of the regulations to provide gratitude to the division for working collaboratively with community stakeholders throughout this process. And that concludes my remarks. I appreciate your time.
Thank you very much. Are there questions or comments from our board members? Is there any public comment on this agenda item? Hearing none, I'll call for a motion, please.
Motion to approve, Dr. Murawsky.
Second, Dr.
It's been moved and seconded. Further discussion from the board. All in favor of approval for agenda item number 7, please say aye.
Aye.
Any opposed? Any abstention? Motion carries. Agenda item 8, consideration and possible adoption of proposed regulation amendments to Chapter 450B of the Nevada Administrative Code NAC, Emergency Medical Services. The proposed regulations remove obstacles for advancement that no longer serve the public's best interests, which include removing the Advanced Emergency Medical Technician requirement. LCB file number R079-22. Shana Reinhardt, please.
Mr. Chairman, Bobby Sullivan, Program Manager, Emergency Medical Services Program. Tina is unable to attend today. I'll be speaking on behalf of this proposed change. In approximately 2015, based on recommendation from the Emergency Medical Services Advisory Board, the requirement was put into place into regulation under Nevada Administrative Code 450B.720 number 8. The requirement being that in order for an emergency medical technician to attend a paramedic training program, they must first be certified as an advanced emergency medical technician. Current standards, which this program recognizes for national education standards and scope of practice, that requirement is no longer seen as the industry standard. A public workshop was held to discuss this among our stakeholders. We received 1 question as to partial training, which was addressed. The rest was in support of this change. We would like to remove the burden of requiring an emergency medical technician to first be certified as an advanced emergency medical technician in order to take a paramedic program of training.
Thank you. Does that conclude your report?
Mr. Chairman, that concludes the report. My apologies, I've had a little audio interruption.
Okay. Any questions from our board members? Any public comment?
Good morning, this is Sandy Worko with Carson City Fire Department Division Chief of EMS. I just want to go on record in support of this change to the NRS to remove the advanced EMT requirement to attend the paramedic program. Currently, to my knowledge, there has been no data to support that requirement increases passing rates in paramedic programs. In addition, we continue to deal with a paramedic shortage in the Northern Nevada region, and we are competing now with in-hospital. As the healthcare shortage has continued, we are seeing more in-hospital jobs and positions open for paramedics. And this is leaving gaps in our community to hire qualified paramedics. Additionally, the state is losing students to out-of-state paramedic programs where this requirement was not in place. And some of those students have, after their internship, chosen to stay in the state in which they attended their paramedic program. So I would like to support that we keep these students in state and remove that requirement for them to attend paramedic programs. Thank you for your time and consideration.
Thank you. We appreciate your input. Additional public comment. Is there additional public comment? Hearing none, we'll call for a motion.
It's Dr. Murawsky. I motion to approve as proposed.
Is there a second?
Carl Smith, second.
Moved and seconded. Is there further discussion from board members? Hearing none, all in favor of approving agenda item 8 as written, please say aye.
Aye.
Any opposed? Any abstention? Agenda item 8 passes, carries through. Next item is agenda item number 9. Consideration and possible adoption of proposed regulation amendments to Chapter 652 of the Nevada Administrative Code NAC Medical Laboratories. The proposed addition changes of regulations to NAC 652 and LCB file number R126-21 include creating regulation for a licensed laboratories for specimen collection, regulations that allow for medical officers in the armed forces to be able to receive necessary medical training in a healthcare center in Nevada, updating and clarifying personnel certification qualifications, adding dentists as laboratory directors of exempt laboratories, and revising the scope of the duties of a general supervisor of a licensed laboratory. Mr. Bradley Waffles, please.
Thank you. Chairman Pennel, members of the board, for the record, my name is Bradley Wakeles, acting manager for the Medical Laboratory Services with the Bureau of Healthcare Quality and Compliance. I am presenting for your consideration proposed regulations noted as LCB file number R126-21 relating to creating regulation for licensed laboratories for the purpose of specimen collection, only with a fee structure that is not overly burdensome on the laboratory. Also, changing regulation to allow for medical officers that are employed by the armed services of the United States to be able to provide clinical laboratory services without the requirement of applying for and obtaining state laboratory personnel certification in a hospital as part of a training program pursuant to an agreement between the armed services and the hospital. Also, regulation changes needed to clarify qualifications for personnel certifications, changes in regulation to allow for a general supervisor of a licensed laboratory to oversee the laboratory operations of a standalone emergency department that is associated with the main laboratory of a hospital. A regulation change to allow for dentists that are licensed in the state of Nevada to be laboratory directors of exempt laboratories, and allowing certified nurse assistants and students enrolled in an accredited school of professional nursing be able to perform point-of-care tests that have been classified as wave tests by the Food and Drug Administration, as long as a person would apply for and obtain a state of Nevada point-of-care analyst laboratory certification. A public workshop was held on the proposed regulations on July 11, 2022. There were 30 individuals in attendance of the public workshop. There was one comment that was made during the workshop, which was in support of the ability for a general supervisor of a licensed laboratory located in a hospital, which was associated with the standalone emergency department, to oversee and be the general supervisor of the standalone emergency department. There were no comments in opposition to the proposed regulation changes to NAC 652 during the public workshop. The proposed regulations were also heard by the Medical Laboratory Advisory Committee on March 25, 2022. There was one recommendation for section 11 of the proposed regulation changes that refers to allowing dentists to be laboratory directors of exempt laboratories which perform waived laboratory tests. A separate vote was taken by the committee, which found the majority of the committee members to be in support of dentists to be laboratory directors of exempt laboratories. There were no revisions made in section 11 of the proposed regulation changes for allowing dentists to be laboratory directors of exempt laboratories based on the majority of the Medical Laboratory Advisory Committee members voting to support the regulation change. There were no other recommendations to the proposed regulation changes made by the Medical Laboratory Advisory Committee. Based upon the small business impact study, the positive supportive responses from the public workshop, and the recommendation for approval of the proposed regulation changes to NAC 652 by the Medical Laboratory Advisory Committee, which would include the majority approval of section 11 by the board, I would recommend the adoption of the LCD file 126-21, and this concludes my presentation of the proposed changes. I'm open to answering any questions.
Thank you, Mr. White. Any questions from our board members?
Dr. Murawsky, just a question. In the exemption for the armed services, section 7, subsection 6, you're saying a medical officer employee. Is that you are just referencing MDs and DOs, or did you need to include dentists in that exemption for to provide clinical laboratory services who's not licensed pursuant?
This would, for the record, Bradley Wakeles. My response to Dr. Murawsky is if you're referring to the armed services, is that
yes,
correct?
Yeah, the armed forces.
So that was primarily for people that were in the respiratory care arena, and that was for the purpose of them being able to draw specimens and run tests.
So in the armed forces, a medical officer is an MD or a DO only. That is what a medical officer is. Dentists are dental officers, and people who are in the medical corps are the other individuals and other folks. So I guess I'd ask, do we need to clarify that? Because if we look at their job title, they'd say they're in the medical corps, but a captain in the Army who's a physician is a medical officer, but a respiratory therapist who's a captain in the Army is not a medical officer. They're a medical corps member who's a captain. That's just, and all the branches are like that. So I guess, is that something we need to clarify, or are we using our definition of medical officer, which is all of these people who perform medical therapy? And I guess that would be more of a legal.
Yeah, and I don't have the proposed regs directly in front of me. Is medical officer defined in reg?
I couldn't find it. It's not in this one, but it might be in another one. I just don't want this to limit something we don't want to limit. Or be confusing. I don't think it defines medical officer, other than it uses the definition of medical officer that we have other places, which is our definition of a medical officer, which is someone who performs those services.
So then we would follow our definition of
Okay.
medical officer.
Okay. All right.
Which is used
Yeah.
in statute.
Yeah, it's used in statute other places. I just wanted to make sure we'd be applying our definition of medical officer rather than the armed forces definition of medical officer. And we just want to make sure they're not confused, that we didn't limit them away from the people we intended to include.
Correct.
So I think it's reasonable. That's fine. I just want to make sure we weren't restricting unnecessarily. In a simple word, switching that jargon from state-based to federal. Gets that sometimes. Okay. Thank you. I have no other questions.
Additional questions from board members or comment? Is there any public discussion on this agenda item? Hearing none, I'll call for a motion.
Motion to approve, Dr. Murawsky. Action item number 9, consideration and adoption of proposed regulations to chapter 652 of the NAC medical laboratory.
Charles Smith, second.
It's been moved and seconded. Is there further discussion? All in favor, please say aye.
Aye.
Aye. Aye.
Any opposed? Any abstentions? Motion carries. Agenda item number 10 is informational, and it is a report to the State Board of Health on the State Environmental Commission by Mr. Charles Smith. Mr. Smith.
Thank you, Chairman Pennel, and fellow members of the board. As you know, I'm the health department representative that sits on the Nevada State Environmental Commission, and I'd like to give my just summary of the last meeting. My notes are included in here, so I'll just kind of give an overview. Item number 1 was amendment to NAC 459, Division for Certifying Individuals as environmental managers, handlers of underground storage tanks, testers of underground storage tanks, providers of approved underground storage tanks. Environmental managers being personnel that deal with handling asbestos or other hazardous material removal. The first item was just increased fees, which were 20 years ago. The second part was to, on the qualifications for the exam, was to remove equivalent work experience and leave the remaining requirement to have a bachelor's degree from an accredited university. That item was reviewed and approved. Second item was a petition to amend NAC Chapter 335BA regulation relating to air pollution. This is simply bringing up the standard to the state federal regulations. The item was approved. The third item was a presentation by the Nevada Division of Environmental Protection for a proposed regulation to set forth the process for the commission to classify a water of the state or segment thereof as a water of extraordinary ecological, aesthetic, or recreational value, or EAW. Classification of surface waters as EAWs and anti-degradation protection are related to as an EAW would be afforded a higher level of anti-degradation protection and maintain the protection of the unique special characteristics of the water. So this was a presentation. There's no regulation in place currently in the state, so this is a regulation that would be able to identify bodies of water that would be meet the criteria of this. Within that, there were different levels of protection or classification of the waterways that are listed here. Currently, Lake Tahoe is the only body of water that is considered an EAW, but it's not formally protection because there is no regulation in place. The California side of the lake is classified and is protected. So this was a motion to provide a regulation that people could bring forth to the commission to certify bodies of water. It wouldn't be limited to lakes. It could be streams and wetland areas. There are throughout the state, even though we think we're in a desert here, there are bodies of water. So this was to develop some standards to be able to provide protection to those waterways and keep them in their pristine condition. That was a presentation. There's further work being done on that. Fourth item was administrative update covering the proposed updates to the state handbook of best management practices. That was simply a presentation. That's an ongoing process. And that concludes my update. Thank you.
Thank you, Mr. Smith. Any questions or comments from board members? Agenda item number 11 is an update on the resolution passed by the Board of Regents of the Nevada System of Higher Education concerning COVID-19 and the health and safety of NC faculty, staff, and students. Carrie Nickel-Juice.
Yeah, this is Karen Takis, Deputy Attorney General for the record. I don't know that there is someone to present this item, but it's included in the supporting materials and is a notice to Board of Health regarding this resolution that the Board of Regents passed and sent to the Board of Health. To the extent that any members would like to take action on the resolution, no action is requested in the resolution, but to the extent that the Board of Health would like to take some action, that'll need to be agendized for a future item. So this is merely an informational item. If any discussion is wanted, that can occur now, but to the extent that any action is wanted, we'll have to put that on a future agenda.
Thank you. Any discussion from board members?
Dr. Murawsky, I think we'll need to discuss for future meeting whether we should ask the, given that this resolution states that each president, based on affirmation of the regional data, will implement appropriate measures, we may ask each institutional president for their plan on how they're going to manage that, just so the board has it, so they understand how they're varying their locality based on their individualized response. So I think we'll discuss that for a future agenda item.
Thank you, Dr. Murawsky. Any further discussion? Agenda item 12 is also informational. Update on medical laboratory compliance agreements after the state of Nevada public health emergency ended. Bradley Waples, please.
For the record, Bradley Waples, Acting Manager for Medical Laboratory Services. Beginning up with the June 5th, 2020 Board of Health meeting through June 3rd, the 2022 Board of Health meeting, medical laboratory agencies submitted to the board for approval 67 compliance agreements for regulations contained within the Nevada Administrative Code. Of the 67 compliance agreements that were submitted for approval, there were only 40 that would have been affected by the lifting of the governor's emergency directive, which ended on May 20, 2022. On April 19, 2022, and an email was distributed to all laboratories that had submitted compliance agreements to the Board of Health for approval to prepare for the lifting of the governor's directive, which would terminate the terms of the agreement. Individuals that had wanted to work for laboratories that were performing COVID-19 specimen collection and or testing without applying for and obtaining a state of Nevada laboratory license certification were notified in the same way that they would need to adhere to the regulations in NAC 652 and obtain the laboratory personnel certification according to the laboratory functions that they would be performing. Laboratory directors were also allowed to be on the premises of the laboratory in which they were directing at least once a quarter during the pandemic. Were also notified that they would need to adhere to NAC 652.370 number 2, which requires the laboratory director of a licensed laboratory to be on the site of the laboratory at least once a month. All notifications were distributed by email. The notifications that were sent by email, which were returned undeliverable, were also contacted by phone if a contact number was available. On Friday, May 6, 2022, the governor announced that the emergency directive would be lifted effective May 20, 2022. On Tuesday, May 10, 2022, a final email was sent out from the division, which informed the laboratories and laboratory directors with compliance agreements and laboratory personnel working under the governor's emergency directive that on May 20th, 2022, the terms of the compliance agreements would be terminated and that all personnel would be required to come into compliance with the Nevada laboratory regulations stated in NAC 652. The compliance agreements, there were 20 agreements that came under NAC 652.195 that were submitted to the board to allow for laboratories with state of Nevada exempt laboratory license to provide human specimen collection and or weight testing at locations other than the address in which the laboratory is located. With some exceptions, most laboratories that are licensed as exempt laboratories perform specimen collection and or weight testing only at the address of the laboratory. Operation at multiple locations is primarily only available to laboratories that are licensed as licensed laboratories. There were 9 laboratories. Of the 20, there were 9 laboratories that were performing COVID tests only at the location of the laboratory. 6 laboratories closed their operation. 3 laboratories converted to mobile specimen collection and testing laboratories performing COVID testing. There were 2 laboratories that I still not received a response from, but continue and try to communicate with them. Compliance agreement came under NAC 652.370 number 2. There were 5 agreements that were submitted to the Board of Health to allow for laboratory directors of the state of Nevada licensed laboratories to be on site in the laboratory that they direct at least once a quarter and to meet virtually at least once a month. Our medical laboratory, this agreement allowed them to be in close contact with other travelers in distant parts of Nevada to meet the regulatory requirements. Our medical laboratory service agency will confirm compliance when there are state inspections performed to ensure the laboratory directors are on site at their laboratory at least once a month. The compliance agreement for NAC 6524855, there were 6 agreements that were submitted to the Board of Health to allow for laboratory specimen collection and/or testing personnel to work under the direction of a laboratory license by the state, but not require the personnel to have to apply for and obtain laboratory personnel license. The personnel were required to have documentation of training competency prior to collection and/or testing, which was determined by the laboratory and approved by the laboratory director to ensure that the safety of the patients and the specimens that were collected, and to ensure the quality and reliability of the patient test results were reported. Our medical laboratory service agency will confirm compliance when there are state inspections performed to ensure that all specimen collection personnel and laboratory testing personnel have documentation of training, competency, as well as meeting the required educational experience requirements for the laboratory testing that they're performing. There were 9 agreements that were submitted under NAC 652.397 number 1 to the board to allow registered nurses that are licensed by their board in the state of Nevada to be laboratory directors of laboratories performing wave COVID testing. As of August 25th of these 9, 1 school was found to be qualified, found a qualified laboratory director to be the laboratory director of their school COVID testing laboratory. There were 7 school laboratories that requested to be closed, and there was 1 laboratory that has still not received a response, but I'm still in communication with them. It should be noted that at the beginning of the pandemic on April 25th, 2020, through August 5th of 2022, the Nevada Medical Laboratory Services has inspected and approved 623 laboratory applications that were submitted to the state for providing various methodologies of COVID testing. In addition, our agency has received and processed an additional 126 federal CLIA certificate applications that were submitted by pharmacies in Nevada to provide COVID testing under the Federal Public Readiness and Emergency Preparedness Act. This concludes my report regarding the update on the compliance agreements which ended after the State of Nevada Public Health Emergency Declaration ended. I'm happy to answer any questions at this time.
Thank you, Mr. Whitehead. Questions or comments from our board members?
Dr. Murawsky, for the record, my personal thanks for all the work the department put in getting all those laboratory requests processed so we could have appropriate testing facilities for our patients throughout the pandemic and maintain the regular usual laboratory services for all the normal diseases that didn't stop because we had a pandemic. And it's great to have this report to transition us from the pandemic phase into the more kind of endemic ongoing COVID phase, so we know where we are at this point and bringing things back to the way we like them. So thank you very much for a comprehensive report.
Thank you.
Additional comments? Thank you, sir. Agenda item number 13, informational update on state of Nevada immunization rates for children, impacts on immunization rates for children, and plans to increase immunization rates. Chrissy Zaginas.
Thank you, Chair. Vicki Ives for the record. I'm presenting for Christy Zaginas today. Thank you for the opportunity. My name is Vicki Ives, Division of Public and Behavioral Health, and I'm with the Bureau of Child, Family, and Community Wellness. Get the slides advanced here. Oh, pardon me, the clicker doesn't seem to be working. it's on. Oh, there we go. Thank you. So really, we're going to just focus on childhood vaccines and adolescent vaccines today with some background information as well around the Nevada State Immunization Program. Really, the program focuses on facilitating vaccine distribution and programs, and we work with a wide array of partners, including local health authorities, hospitals, schools, clinics, correctional facilities, federally qualified health centers, tribal health clinics, medical schools, a diverse variety of partners, and really focus on equitable vaccine access for all of Nevada's populations. And really promoting a culture embracing immunization to protect the public from vaccine preventable diseases. The program manages Nevada WebIZ, which is Nevada's immunization information system, and manages a number of publicly funded vaccine programs, including vaccines for children and other federal and state programs focusing on underserved populations. So with this immunization information system, or Nevada WebIZ, it's a confidential database looking at population-based data, recording all immunizations administered by participating providers within the state. And all vaccinating providers in Nevada are required to report into WebIZ. And then there's some data points just to give you a sense of the volume of a little over 5 million patient records currently, including some for non-Nevada residents. One element of functionality that might be of interest is the clinical decision support for immunizations, which really forecasts what vaccines are needed based on an individual's age and vaccine history. And it also just allows access. My apologies, we're having some feedback. Thank you, excuse the interruption. Pardon me, should I turn off the mic? Thank you, pardon me. Thank you. So just that it allows identification of underserved populations, the distances folks travel in order to receive vaccinations, vaccine uptake. So it's the system really supports, geospatial analyses and along a whole range of types of information. There are some limitations in terms of the completeness of the fields vary, particularly in relation to the race, ethnicity, and patient county fields, which impacts data for analysis. And the population of patients reflected within Nevada WebIZ may not necessarily reflect the true population of Nevada because it does include some individuals who live out of state. So basically in the data that'll be presented in a moment, just Nevada WebIZ data, using that as a denominator can usually trend towards an underestimation of protection rates, whereas using state demographer data as a denominator can cause a bit of an overestimation of protection rates. And just that there are some issues around, migration in and out of the state, in terms of accuracy, but young children is generally the most accurate reflection of reporting within the system. And within Nevada, we follow the Advisory Committee on Immunization Practices, recommendations on vaccines. This panel of medical and public health experts reviews clinical data to generate age and condition-based recommendations. And providers enrolled with the Nevada State Immunization Program also follow the ACIP recommended vaccine guidance. This just gives you an overview of the school required vaccines. Existing law does require children to receive certain vaccinations to enroll in school or in child care facilities. There is an exemption process that's outlined in both statute and regulation, where exemptions for religious beliefs and medical conditions are provided to the school or child care facility on a standardized form. And just in relation to exemptions, we have noted in 2021 to 2022 kindergarten data an increase in religious exemptions of those schools submitting immunization survey reports. In public schools, about 22% have religious exemptions currently, and 39.8% in private schools among kindergartners have religious exemptions on file. And this is in contrast to 2020-2021 data, where those rates were 3.5 in public school kindergartners and 5.37 in private school kindergartners. So just drawing that trend to your attention. As well as in red, you'll notice a new requirement for meningitis prevention of 1 dose on or after 16 years of age in order to enter 12th grade in red. And this just shows the ACIP recommended vaccine schedule, just to give a sense of the age ranges and complexity. And we're going to be focusing on a few data slides specific to the infant vaccine 7 series. So in this slide is, again, infant 7 series vaccination rates in Nevada from 2019 to 2021. Really wanted to draw your attention in looking at 2020 as opposed to 2021 percentages. There's a 13% change from 2020 to 2021, a decrease in the infant 7 series vaccinations. The program did do a reminder recall campaign this spring, focusing on 0 to 13-year-olds in communities of color and rural and frontier populations where data show not as up to date on 7 series, and just under 6,000 postcards were mailed focusing on Clark, Nye, and Lincoln counties due to 7 series rates to encourage completion of the series, and that effort is under evaluation. This is a rather busy slide, but really just wanted to call your attention. It's the same 7 series over the same 4-year period, but breaking it out by race and ethnicity. There, in the American Indian, Alaskan Native population, we see from 2020 to 2021 in infants a drop from 35% to 25.1%. Also wanted to highlight among Latinx infants, even though there was also a drop from 2020 to 2021 from just about 60% to about 50%, the 2021 50% data point is still the highest of across race and ethnicity groups for 2021. So this is showing actual percentages. This next slide just highlights the same data, but in terms of percentage change. So you can see the largest orange bar shows that decrease in the American Indian, Alaskan Native infants in percent change. And you can also see in the Latinx infants the almost 15% decrease, but that group still had the overall highest rate in the 7 series across the board. And this really just shows that using 2020 to 2021 data of infants who have not completed the 7 series, how many additional vaccines they need in order to complete the series. And you can see 67.3 need 4 or more, followed by those infants only needing 1 to complete the series. Sorry. It's not advancing for me. There we go. Okay, so an overview on recommended adolescent vaccines, just for your reference, we'll be focusing on tetanus, diphtheria, pertussis, men ACWY or meningitis prevention, and HPV. And this really just is in looking at the rates of our 13 to 17-year-olds in Nevada, looking at HPV, men ACWY, and Tdap over a 4-year period. Just wanted to note, unlike the 7 series, we see an increase for HPV and men ACWY, looking at the trends over time, and a decrease in the Tdap. And looking at the same 3 HPV, men ACWY, and Tdap vaccines among the same population of 13 to 17-year-olds with at least 1 dose by race and ethnicity. Just really wanted to highlight that Black and Latinx adolescents have higher initiation rates of HPV, men ACWY, and Tdap than the other ethnicities and races. And also wanted to note among Asian Pacific Islanders and white adolescents, they had the lowest HPV uptake, as well as in the American Indian, Alaska Native. We do see there's sort of a U-shaped curve showing some rebound between 2020 and 2021 in most of the race and ethnicity groups, except for the American Indian, Alaska Native population, where that trend from 2020 to 2021 was for a decrease. And on this slide, we're shifting gears to focus specifically on HPV initiation and completion rates in 13 to 17-year-olds, looking by gender and across a 4-year period as well. In the circles are the persons up to date, percentage of persons up to date. And really, there's an increasing trend over this time period in the percent of persons up to date, both female and males for this age group. And if you look at the males, the gap between the female and male percent of persons up to date closes a little over time. It gets a little narrower. So looking at the same data, same age group, same time period, by race and ethnicity, again, we see this decline in the American Indian, Alaska Native 13 to 17-year-old HPV rates from about 29% to about 27%. And we see, again, the highest completion rates among Hispanic or Latinx youth. And switching gears to meningitis here and men ACWY. And again, there's the updated meningitis requirement that came into play this August, this school year, where at least 1 dose of men ACWY is needed on or after age 16 in order to enter 12th grade. So these data are from the end of July for 16 and 17-year-olds entering 12th grade as of this August, who are up to date. And shows it broken out by county, but when looking across all counties in Nevada, the overall rate is 22%, roughly around 16-year-olds, and about 37% among 17-year-olds, where we see the lowest uptake White Pine 16-year-olds and the highest in Eureka 17-year-olds. And looking at 16 and 17-year-old data, again, and up to date by race and ethnicity for meningitis protection. Again, late July data. So some of the back to school vaccinations and pushes would have, still been going on, but just wanted to note other race, non-Hispanic at the highest rate of up-to-date and unknown race ethnicity at the lowest at 9.6. And with that, just one brief mention in case it's of interest in terms of COVID and vaccinations in the very youngest population, that uptake remains a little slow. Only 1.9% of 0 to 4-year-olds, 6-month-olds to 4-year-olds have initiated vaccination, and that as opposed to our 5 to 11-year-olds with COVID vaccinations are at about 25%, and 12 to 17-year-olds at about 55%, in case that's helpful. So just wanted to note with the bivalent availability, we're still utilizing monovalent in our 6-month-old to 11-year-olds for primary and for boosters, so that it's a little different for our youngest than the new guidance around bivalence for adults. And with that, happy to take any questions, and thank you so much.
Thank you for a very thorough report. Any questions or comments from our board members?
Dr. Murawsky, question. You mentioned the exemption increases in the youngest children at pre-K kindergarten. Are those exemption increases seen across all vaccines, or are there particular vaccines that we're seeing increases and exemptions for?
That's an excellent question. Thank you. And I would have to get the data and respond back, because I just have the overall exemption rate at hand today, but we can provide that. So thank you.
The concern is just making sure if we have a particular disease, or if it's all diseases, we're going to need to, with rates that high, we're getting lower than herd. We're going to have to inform the healthcare community that they need to be on the lookout for diseases we particularly haven't seen in a generation. So we're going to have a generation that's defined by diseases we haven't seen for 3 generations with physicians that have never seen them. So we're going to have to really re-educate physicians and the healthcare systems to look for things they haven't seen before. So that's, if it's all of them, or if it's MMR, or if it's polio, that we need to look for something.
Thank you.
Thank you. Any other questions or discussion? And item 14, are there any recommendations for future agenda items from our State Board of Health? Hearing none, I will open the meeting up to general public comment. This can be on anything that you would like to comment on. There will be a 2-minute timer started when you start your public comment. And the floor is open.
I have a public comment just for the record. This is Dr. Colleen Lyons, the Carson City Health Officer. Much appreciate the state's presentation regarding immunization rates in children. And I find how to word this politically. I'm very glad to see the higher immunization rates among our generally marginalized communities, those being the Blacks and Hispanics. It's interesting to note that the Asians and white population are declining or avoiding immunizations. I would say, thankfully, when we do have that outbreak of disease, they likely will be in a better socioeconomic position to finally get those immunizations when we have that measles outbreak, or we have that first case of meningococcal disease. And agree with the board's comment regarding educating physicians on having seen these. I've been in practice long enough to have seen a number of your H. flu meningitises and a smattering of measles, but yes, we're going to need to educate providers to look for these diseases. in regards to monkeypox at the last board meeting. We're putting out information about the lesions looking like pustules, but of course the whole process starts as macules. So I advised anyone with a rash and a fever needs to be seen. And that concludes my comments.
Thank you, Dr. Lyons. Joan Hall.
Good morning. Thank you. My name is Joan Hall. I'm the president of the Nevada Rural Hospital Partners. I missed my opportunity on item 7, the cancer reporting regulations, to just give this statement. So I appreciate the time to be able to do it now. I just really wanted to thank the Division of Public and Behavioral Health staff who allowed both Nevada Rural Hospital Partners and the Nevada Hospital Association to express our initial concerns on these regs, especially as it related to reporting and abstracting and some of the timelines. The division heard us, they listened to us, and in the end developed regs that we could support. And I just wanted to let the board know that we appreciate them. Thank you.
Thank you very much.
Kayla Samuels, Division of Public and Behavioral Health for the record. Chair Pennel, if I may request that you facilitate or allow me to facilitate the identification of any individuals joining us over phone so that support staff may accurately transcribe it in the minutes.
Yes.
Thank you. If the individual calling from 702-806-7439 may identify themselves, and you can press *6 to unmute. And then one more time for the individual calling from the phone number ending in 7439. If you are able to unmute and identify yourself for the minutes, that would be greatly appreciated. All right, seems like you don't have an individual there. Thank you so much.
Is there any additional public comment waiting?
Autumn Blattman, DPBH for the record. I don't see anybody with their hand raised, Dr. Pennel.
Okay, thank you very much. Public comment is closed. Appreciate everybody's input and participation today. Board of Health meeting is adjourned. Have a great, safe weekend, everybody.